Good morning, everyone. It is 5 in the morning. I woke up at 4:45 because if you didn't know, today is, what's today? Can't remember. August 28th. It's the day of my surgery. So I had to stop eating and drinking at midnight, but I went to bed, I think 11, if not before 11. I don't remember. I honestly don't remember. But you missed out on a lot, and I'll tell you guys the story maybe tomorrow if I'm feeling up to it. If I'm not hurting or anything, I'll tell you the story of what happened these past 2 days because I did not record. But the surgery is for endometriosis, and they go through my belly button and the left side of my stomach, insert a gas, go in with a scope, and if they see endometriosis, they'll like solder it off or burn it off. And then if my fallopian tube is too far from my ovary, they'll move that and adjust that too. So that's the plan today. And yesterday I started getting a sore throat, so I think I'm starting to get a little sick. Josh is gonna be driving us.
Huh?
I said Josh is gonna be driving me and my mom to...
No, I'm not driving.
Yeah, you are.
You're driving.
Why am I?
I'll drive.
You're such a baby. Oh, and if I didn't tell you, it's an outpatient thing, but I just don't know how long the procedure is. Wish Mama good luck. Give me a good luck kiss. Give me a good luck kiss. Thank you. Alright, everyone. We made it here. We got my mom. And we're ready to go in.
We got boy.
Oh, and we got boy. Josh. You guys ready? You excited?
Yes. Let's get this.
Here we go, people. Let's go check in. You guys better do a good job of vlogging for me. I'm not kidding.
Oh crap, I forgot about that.
Yeah, you gotta vlog.
Josh, you got better eyes.
Yeah. Oh, take a number and have a seat. Okay. Alright, this is my room. There's my urine. I gotta put that on and my gown. But this is the little room that I'm in. My mom and Josh have to wait and then they can come in soon, but I want to get dressed and see what happens. And there's like the IV stuff. The only thing I'm nervous about is the IV because I've had very, very bad experiences and it was very painful. So that's what I'm freaking out about is the IV. Any surgery I can do, but IVs, I've had too many bad experiences. But I'm gonna shut up and get dressed. I am prepped and ready for surgery. I'm so excited to get this done. I just don't want the IV. And the lighting is horrible. But I'm ready. Got my gown on and my cap on. So I'll see if my mom or Josh will record the process of the IV and if they even record for me. So if they don't, just be mad at them for not vlogging for you guys. But I'll see you guys in a few. Wish me luck.
So how you feeling?
I'm good. I got my IV in. Get a close up of that, honey.
They took your apple juice away.
My pee?
Yeah.
Oh, I was gonna say, huh?
I got my IV in. First they did like a cold spray because I told them I didn't want it in my hand. I want it right here. So they did a cold spray and then a numbing thing, and then they did the IV. So I was happy, and anesthesiologists or whatever you want to call it don't like it there, but I don't really care what they think. So I got it here instead of my hand. I want to let them go near my hand. No, now it's just a waiting game. The procedure takes an hour, about an hour, and then I have to go, and then when the procedure's done, I go in the back room for about 30 minutes or so until my pain is under control. Then I come back to this room.
They all loopy.
I don't know. You better record me if I am. Record everything, honey. Yeah, fine here. There we go. Do I look pretty?
At least you'll match us, right?
Yes.
Everyone, bye.
Goodbye. You guys are gonna have a lot of
Do you want her phone, or do you want me to put it in my purse?
You can put it in your purse.
Yeah. Alright, let's go. Let's hit the road. Oh. Love you. Give me keys. Love you.
Is this okay in here?
Yes, you can keep everything in here.
Bye.
Alright, we'll be back.
Peace out. I'm going to sleep.
Love you, Mama.
Love you. Take a nap. Drink coffee.
Grab a seat.
Uh-oh.
No, it's okay. First thing we noticed was adhesions going from the fat pad that surrounds her intestines kind of up to her abdominal incision. That's super common. We see that all the time when people have had previous surgeries. The reason it's kind of a big deal is sometimes you can have bowel obstructions because of it. Your intestines have to go through goofy loops when things are scarred to that anterior abdominal wall. So we took those adhesions down. So that's gone. She has stage 4 endometriosis.
Oh, no.
So tons everywhere. Over the bladder, behind the uterus, and over the colon, where both ovaries live. It was bad, just as we suspected. 100% that's the reason for her pain. We were able to burn probably 90% of it away. It scarred her remaining ovary to the side wall of the pelvis, and the tube was kind of scarred in there too. So we freed up that ovary from the side wall of the pelvis, took down all of the adhesions and capsule that kind of surrounded that left tube and ovary. And fortunately, that tube is still open.
It is?
It is. I didn't think it was going to be, looking at it. But after we took down all the scar tissue, it opened up. It's good news because it gives us the explanation for where the pain was coming from. The first step in management is done. So we burned as much as we could see away. There was one spot on the left-hand side over the top of the ureter, so the tube that goes from the kidneys down to the bladder, that we could not burn away. Because obviously we don't want to damage the ureter because that can shut that kidney down. It has nowhere to drain, and then you can do permanent kidney damage because it swells. So we have to be very careful when we're burning over the top of the ureter. But that was really the only place that we couldn't burn over the top.
How do we watch that? I mean,
So I think the game plan moving forward should either be aggressively pursuing pregnancy or going on a medication for a couple of months to burn some of those microscopic implants away, and then aggressively pursuing pregnancy when that time comes. I would probably do the medication first, just to more efficiently treat what's there, because the implants of endometriosis depend on the hormone from her left ovary to stay alive. So the medication that we use shuts that ovary down, and if her ovary isn't making hormones, those implants of endometriosis die off. Knowing that there were some that we couldn't efficiently treat above that ureter, I would want it all treated first. Either way is reasonable. I mean, now we know that anatomically things are opened and
So do those grow back, or so you gotta keep doing that? Like repeating?
well, we have to keep her on medication that prevents her from cycling. So either we have a list of medications that we can use to prevent her from having periods, or she needs to aggressively pursue getting pregnant. I mean, it kind of depends. It's an injection that we use to shut the ovaries down.
is that like a depot?
It's similar in terms of it's one injection that lasts 3 months, but it actually works at a brainstem level, and it shuts the ovaries down from a brainstem level, the ovary down from a brainstem level. So
That shuts it
similar.
down for 3 months.
What's that stuff called?
Depot, because it means that it's slowly releasing. This is Depo-Lupron. Symptoms of menopause, because we're shutting that ovary down. So hot flashes, night sweats, being emotional,
Wow.
Yeah.
Wow.
you know. So
Do you feel that she can still successfully have a child?
I do.
You do?
I think she let this go another year. Not a chance.
Right.
No way. Because that left side was already starting to get It was essentially glued to the left pelvic sidewall.
And you can't see that through ultrasound.
For her age, it's a pretty bad case. I feel bad for her. I mean, she's probably had this probably since she was started cycling. Okay?
I need to go to the gift shop and get that big, huge giraffe.
All right, Mama.
Thank you very much. Oh, thank you. Don't make me
See you
cry.
next time. It's nice meeting you.
Careful. Yeah, you too. Thank you.
Okay.
Oh, sorry. Okay, your knees are. All right, Audrey, good luck.
Thank you.
This does not look comfortable, but she says
likes
she is.
it.
Okay.
You have a good nap?
Yeah.
You're so beautiful.
I know.
I got your card.
I do.
Yeah.
Can I have a kiss?
Not if your breath stinks. You want to try drinking water? Sip.
No.
Yeah. Lips are dry. Where's your did I get your chapstick? Would you like to say anything?
No, you do it.
Audrey has a new friend. This is what her mom brought in for her. What's his name?
I don't know
He's pretty tall. It goes up to my chest.
yet. That's it.
Yeah. He's huge.
You don't have to do anything. You don't have to do anything. I feel like it's just your muscles are all tight.
No, my neck is. I don't know what's going on.
Your neck hurts.
I think it's like tense and stuff. I don't know. The things I go through.
Feeling better?
Yeah. Maybe I was stripping to maybe some of it down in the water.
Look like an old lady.
I am old. Who's driving?
I don't know how you driving.
Your necklace is still there. Oh, he's turned a little bit. Big one.
On our way home, finally. How you feeling? 2:30.
I feel like crap.
Well, we only been there about 8 hours.
Good morning, everyone. Do not mind how I look. It is now 2 days since I've had my surgery, and I am sick. I have a stuffy nose, so I'm coming down with a cold, and my birthday is in how many days? Today is August 30th, and my birthday is September 1st, so how many days is that? My birthday's in 2 days, and I'm sick. And I'm recovering from my surgery still. We did not get the news that we were expecting. I mean, it's like good news slash bad news. My endometriosis was stage 4. It was the worst that they've ever seen. The doctor said I probably got the endometriosis right when I got my period when I was a teenager. So the very first time I ever got my period is probably when this all started, and it just kept getting worse and worse. And if I waited longer, maybe if I would have waited another year before this surgery, I would have been able to have kids because it was so bad. It was an 1.5 hour surgery. It was only supposed to be an hour, but since it was so bad and severe, it was an 1.5 hours. They are going to be putting me into menopause for 3 months. Then after the 3 months, me and Josh can try to conceive. And if, I don't know like everything because I gotta see my doctor next week on the 6th, I think, or something like that. So I'll ask him if we try for a month, and my doctor does not want me to get my period at all. He wants me to be in menopause, or if I'm not in menopause, try and get pregnant, and if I'm pregnant, then I don't even know what I'm saying. But I will just show you like I'll show you my stitches. I mean, there's 3 little tiny holes. So I'll show you that real quick. Alright, I got this one on my belly button. One on my left side, and then one on my right side. So it's just 3 tiny little holes that they did, nothing major. So I just wanted to tell you guys that my recovery is going pretty good. I'm just sick now. My whole body's sore, like everything is so sore. I don't know why, but like if you touch me, it's just like sore for whatever reason, especially like my shoulders and my neck. Oh, so sore, so sore. I did throw up. After the hospital, I went to my parents because Josh had work that day, and Josh helped me walk upstairs, and right when I hit the bedroom, I threw up in the barf bag. Here, I got a barf bag here. Let me show you. I threw up in these barf bags. Thank God we have these from the hospitals. This one's from when I was going through chemo. This is what I threw up in. This is a barf bag. I threw up when Josh was helping me. When I threw up right when I hit the bedroom. 3 times I threw up in the bag, and it was like coming out my nose too. That night I threw up again. I ate some cereal and I was feeling nauseous, and I threw up like 4 or 5 times in another puke bag, but I haven't thrown up since. I don't even know what I'm saying. I'm just like tired, I'm sick, I'm recovering. My birthday's in 2 days. I feel like crap. I feel like crap. But I guess on that note, I will end the vlog here, and I'll see you guys in my next vlog. Bye.